Hospital, and I'm the chairman of this conference. This conference is an international ophthalmology conference, and this year it is dealing with glaucoma and uveitis, which are extremely common eye diseases in Kuwait and in the world. We have 8 international speakers who have come from near and far. Some of them have traveled all the way from United States of America and Canada to be with us today. And the program is spread over 3 days. It's a very interesting program. We have lots of seminars and lots of roundtable discussions and a lot of surgical video presentations by our speakers. So I'm predicting a very good outcome, and I'm hoping that ultimately all these activities would benefit the patients, and we will hopefully come up with some guidelines for glaucoma and uveitis after this conference.
I'm a consultant ophthalmologist at Al Bahar Eye Center. Today we're having the 15th ophthalmology conference of Kuwait, and the main topic is glaucoma and uveitis. And we have 2 visitors from the USA, 2 visitors from Canada, 1 visitor from the United Kingdom, and 1 visitor from Saudi Arabia. And the main topic of this conference is glaucoma, which is one of the leading causes of blindness all over the world, especially for certain age group. Our visitor is going to talk about types of glaucoma, most commonly the open-angle glaucoma, and different various types of glaucoma. Also, pediatric glaucoma is going to have a fair sessions of discussion, because it's one of the leading causes and one of the difficult diseases to treat. Uveitis is also part of this meeting, and a visitor from Saudi Arabia is going to discuss the recent advances in this field. So in this conference, we are looking forward to the new development on the treatment of glaucoma. We are looking forward to hear about the new tubes and the new surgeries done to try and control this blinding disease.
Second part of the show. We're going to have the first guest today, Dr. Osama Samadi. He is a doctor in genetic in Dasman Institute, and we're really proud to have him today with us. Hi, Dr. Osama.
Hi, how are you doing?
Thanks for accepting our invitation, Dr. Osama.
Thank you very much for the opportunity. Thank you.
We've heard, Dr. Osama, you are going into lots of promising studies here in Dasman Institute. So can you tell us a little bit more about them, please? What are they? And
It'd be my pleasure. So here we are at Dasman, number of research teams dealing with diseases from different perspectives. My own area of interest is using genetics as a tool to understand diseases in Kuwait. And these are diseases that are affecting both society as well as families. And when we talk about society diseases, these are the chronic common diseases most prominently are the obesity as well as diabetes, and these are touching, as we know, a lot of homes and the overall country. We are also interested in looking at family diseases, and these include hearing loss because of genetic defects, kidney diseases, for example. We are also looking at those, and this is all important to families because these are diseases that we take from our parents. So this is the foundation of genetics. So really all of our genetic information is passed to us from our parents and grandparents, and we will pass it to our children as well. So genetics and health are really very well connected to each other, and that's our interest.
So why are you interested in genetics? What made you really like this?
Well, again, because of genetics is really holding the secrets of life, and it can tell and predict if someone is going to live healthy or may suffer from a particular disorder. So these are, generally speaking, important to everyone, but when it comes to individual, this is knowledge that you cannot predict except by doing real genetic research on a given individual. So it's not fortune telling, it's really based on science and technology and advanced knowledge and using tools that are all today available to us in Genome Center here at Dasman, and we are started a number of research programs to look at this, and we're happy to say we're really making good progress in this field.
Exactly. I think the knowledge of genetics, and it plays a huge role in not only knowing the disease, but also it might help us also how to manage the disease in a better way as well. So can you tell us about your research? What are the areas you're interested in?
Well, let's start at the beginning, which is until this point, it's been near 4 years from building the capacity of research here at the Genome Center at Dasman Davis Institute. So we are, to begin with, looked at the chronic disease, which I started mentioning, which is diabetes and obesity, which are very well connected. We think, in fact, that obesity is a risk factor for diabetes. So they are not separable from each other. So we took our first main study by introducing the research to the public. And we have interacted with the University of Kuwait and the Ministry of Health clinics, as well as patients who come here at Dasman for caring by the clinicians. So it was a matter of interacting with the society, the community, and we have managed to collect actually hundreds and hundreds of participants biospecimens from those, namely genetic material, by volunteering in this study. And we, again, look at complete genomic makeup of those individuals. And we take not only those with the diseases, we also worry about the ones who do not have the disease. So it gives us better understanding by comparing the genetics of those with the disease and those who without. And by comparing this will provide the knowledge we need, so we have better understanding why such diseases are touching Kuwait in this serious number of cases per capita, and we think we, by doing this with understanding, we will be able to offer, after explanation, hopefully some also therapeutics and some treatment options, as well as also for someone who's not sure what their future is holding, we will be able to give some prognosis, meaning we can predict the likelihood of someone is coming down with obesity or diabetes or not, based on their genetic knowledge, which is specific to those individuals and cannot be drawn from neighbors or next country and so on. It has to be done here.
Dr. Osama, since you are focusing a lot on the chronic diseases, and you know there's a lot of people, maybe millions of people have been suffering from chronic diseasing, they are really hoping for a permanent cure for all these diseases. Is there any hope with genetic, corrections later on, maybe in the futures, of a permanent cure of all these kind of chronic diseases?
If you look at chronic diseases from a treatment point of view, the treatment, meaning therapy using drugs and medications, are absolutely one option, and that's beyond my personal experience as a researcher, and this is more of a clinician's experience who who look at these chronic disorders. However, from researcher point of view, understanding the disease, complexity of obesity and diabetes, as we know it, it is not, as now we know, is because of one single gene defect. It's really a number of
Multiple
genes coming together as being carrying certain variations in these genes that affect together this disease. So, looking only from a genetic, perspective, yes, it will provide some explanation, partial, but the treatment is, we share the responsibility, but I think there is also responsibility on the patient themselves. How that is meant, because these disorders, while we acknowledge genetics is responsible, but it's not the only responsible factor. There is a second part which is in us, which is basically the lifestyle we are holding, and that includes the diet we eat, how much we exercise or not, if we do other risk practices such as smoking or not. So all these together is really leading to what we see today. So we hope to shed some light from our perspective, but we will need also help from the society itself.
So what are the latest research that you've done or you're working on at the moment?
Like I mentioned before, so the first major study was this population genomic research on obesity and diabetes as combined disorders. So in those we have gathered nearly 3,000 with collaboration with partners here of participants from all over areas of Kuwait. We're looking at their complete genome. So right now we are in the phase of actually looking very focused analysis using, again, computational tools by looking at hundreds of thousands of genetic markers, not one, not two, hundreds of thousands, using the, again, technologies available as to here today. So we already have identified some risk markers we believe are holding. However, this kind of study again requires the participation of the society altogether. So we always depend on more and more participants to really join our research.
Yeah.
And we like to encourage the society to join us and not to be scared of research. Research is really not
it's really
dangerous,
helpful.
it's helpful.
Absolutely.
Absolutely, something that is useful for them, to later benefit from our findings, because this will be knowledge-based, treatment and management of these diseases, which can only come through research. The second perspective, which has family disorders.
Yeah.
We already looked at a number of diseases, including immunodeficiency disorders, by collaborating with Kuwait University clinicians from there. We are also looking at kidney disorders, and we are happy to say we were able actually to identify specifically what is wrong in these families in terms of where is the defect in the genes responsible for these diseases. I can show, for example, here one example, perhaps we
Sure,
can,
yeah.
at this point, one of the findings, and I'll be happy to share that with
That
the
would be very
audience.
good. And what kind of, this is the image you want to talk about, so can you comment on it, please?
So this is just one diagram where we are trying to show some of our results by looking at a particular set of patients who happen to have immune disorders where they are unable to fight the infections from the first days of life. And those are patients who are compromised because of unable to fight infections. And we looked at the number of families who happen to have the same disease, and we were able to identify what's the genetic defect. And this,
Wow, that's good.
and this happened to be carrying in one of one gene that is interacting with, as the diagram is showing, where there is a complex of proteins that are, of course, are encoded by the genes, and genes and proteins at the end are well connected. So this complex that is responsible for triggering important genes that are important for our immune system are defective. This whole mechanism is unable to actually, it's like a cascade, chain reaction. And we are able to find a defect in these families because they are unable to form the important complex that is important for transcription of genes, as we say. So meaning translate these proteins, genes to proteins, and the proteins responsible for the functions that our body needs to fight infections. through cells and antibodies, etc. So it's really, genetics is, we like to simplify it, but it's also is not a small science. It's really very deep science.
It's actually really complicated.
Yes,
and it's extremely difficult, but what you're doing is amazing, really. Have you published this in any papers?
Yes, in fact, this particular study has been published in the Journal for Clinical Immunology.
Yeah.
And people can look it up, you know, if they care, or they can write to us later, and we'll be happy to share it. And this is important finding, not only because it also explains what is the reason for immune disorders these patients having, it's also happened to fall in a region important for also obesity genes. And you can imagine now how disease, infection, and obesity is suddenly connected because of some, locality in these genes that, exist in a certain part of the chromosome near each other. And this protein complex that happen to be defective is also controlling those obesity genes. And we think this is really an interesting finding where suddenly genetics can explain a lot of what we see. And this is only beginning to us, and that really holds a lot of promise for translation, to counsel the families, to use this knowledge for their relatives. They are able to be tested as a research facility, because we are, to be clear also, not diagnostic team, but we are research team. And
Exactly.
our
So
part
this is
is
your
to
role.
bring knowledge, and then this knowledge will be used by the right authorities in the country
think so
to
too.
take it into patient care and management.
Now, the thing is, Desman Institute are doing a lot of things, and they are, the leaders in this research. And of course, with your help and assistance, a lot of things have been done. Are there any other team members you would like to thank on the show?
Actually, I would like at this occasion to really present my thank for the overall country that's really supporting us,
Yes.
The state of Kuwait, the leadership of Kuwait, and also to thank the Kuwait Foundation of Advancement of Science, who really been very generous and supportive to us. And we also want to thank the society who has been caring to really be part of our research, and we encourage them to even become more engaged, with us. So we are doing useful research. At the end, that comes back to their good health.
Thank you so much, Doctor.
It's my pleasure.
It's been a pleasure meeting you.
Thanks a lot, Dr. Osama. We wish you all the best in your
Thank you
research.
very much.
Thanks a lot.
Now we will go into our short break, and we will be back with another guest, and he will talk about hypertension. So stay tuned and don't go anywhere.
Hello everyone, I'm Zainab Al-Musa, registered dietitian from the Desman Diabetes Institute, and today I'm going to be talking about healthy lunchboxes. Kids spend approximately 8 hours a day in school, which constitutes a third of their day, and they perform various activities, activities that stimulate their minds, activities that stimulate their bodies. In order for them to have enough energy to last with them throughout the day, they need to be properly nourished. Now, canteens these days don't usually supply healthy foods. They usually have snack foods, which are popular with kids, like potato chips, chocolates, juices, and sodas. And so sending your kid away to school with a healthy lunchbox is a good idea and a good start in promoting a healthy living for your child. A common lunchbox item is just the good old sandwich. You can put in different fillings. Make sure you put in a filling that your kid likes. For example, if your kid doesn't like tuna, then don't put in tuna, because you want them to have something that they'll eat, not something they'll throw away when they go to school. A lot of kids like turkey because it's mild. It doesn't have like a strong flavor. So you can put that in. You can add honey mustard or different like dressing. Some people add like a bit of balsamic vinegar to give a bit of tanginess. Something else that you can add like as a snack, or something that they can eat with the sandwich as opposed to potato chips, just plain old carrots. You can put in dips like pesto or something if you want them to add like a bit more flavor. You can also use celery. And that's another healthy option, or cucumbers if your kids like cucumbers. And you can just pack them in easily. Some kids don't like them to be in bags because once that you put them in their backpack, they tend to get squished. So you can use like these containers and just put in their sandwich with, I guess, the side, like carrots or, as I said, celery or something else like that. And just pack it and put it in their backpack for them to eat. Another option other than turkey would be labna. A lot of kids like it. You can add in a bit of vegetables, just cucumbers or tomatoes. If your kids will accept it, just a bit of mint leaves, which gives them a lot of vitamins and minerals. Another thing that kids tend to like, if they're not allergic to nuts, peanut butter. Add a bit of honey for sweetness, or bananas. So that's another option you can use. And some parents don't think peanut butter is healthy or it's fatty. Actually, it has a lot of monounsaturated fats, which are really healthy and are good for kids, and they help them feel satiated, so they won't feel hungry after an hour. Okay, another thing that you can add instead of chocolate or potato chips, just nuts, which also provide them with poly and monounsaturated fats, which are healthy fats that promote, that are good for the brain because they help renew the cells. Also, they have a lot of calories, so your kids will stay full for a while, and they won't crave things like chips or chocolate. Another thing that you can add, just plain old dried fruits, because they're sweet, so they can satisfy a sweet tooth. Also, just plain old fruits, bananas, apples, whatever fruit is in season is even better because it has more vitamins and minerals. And a lot of kids tend to like juice. I'd stick away from juice because it has a lot of sugar and tends to contribute to the bouts of hyperactivity that kids get during the classroom, so it'll decrease their concentration. So I'd go with milk, which gives them calcium, protein, vitamin D for strong, healthy bones and teeth. If they don't like milk, then just go with yogurt or liban if your kids like it. And also, kids run around all day, so they lose a lot of water through sweats and breathing. So just make sure you add in a water bottle so that they stay hydrated throughout the day. And make sure you eat your vegetables and exercise often. Thank you.
Welcome back, dear viewers. Now we're going to move to the next part of the shows. We're going to have a meeting with Dr. Jabir Mohammed. He is a very promising family physician coming soon, and he's going to talk to us about the most common hypertensive disorder or chronic disorders that most of the people nowadays in Kuwait are facing. So thanks, Dr. Jabir, for accepting our invitations
Thank
today.
you very much. First of all, I'd like to thank you very much, Dr. ANOUD and Dr. Noor, for inviting me to the show. Today I'm going to talk to you about hypertension. I'll start first with a definition of hypertension. Actually, hypertension is one of the most important preventable diseases that causes mortality and morbidity in the developing and the developed world. It is a major risk factor for cerebrovascular events, for cardiovascular disease and ischemic heart disease. We define it as a clinic reading of above 140/90. When we find a patient for any reason, when they come to check their blood pressure, they have a blood pressure of 140/90, we send them home and tell them to check their blood pressure at home. In the past, we used to check their blood pressures. We have 3 readings in the clinic.
Exactly.
Every reading is 1 week apart. And then we decide, if the 3 readings were high, then we decide that this patient is hypertensive. Now, this approach has been changed.
This is the latest guideline,
This is the latest guideline, the NICE guideline, August 2011. The latest guideline stated that in order to diagnose a patient with hypertension, we have to take readings from 4 to 7 days at home. 1 reading in the morning and 1 reading in the evening. Then the patient comes back to the clinic. The doctor will calculate the average of the readings in the morning and in the evening. If the reading was, the average reading was above 135/85, then this patient is diagnosed as hypertensive, stage 1.
Yeah.
Okay?
This is very good things because a lot of people who come to the clinics and we measure their blood pressure, they have something called the white coat
The
syndrome.
white coat hypertension,
Yeah,
yes.
so
Yes, true.
their blood pressure will be very high, and
Yes.
then just because they are afraid of the white
Exactly.
coat or
Exactly.
the doctors,
Exactly.
you know.
Can you tell us about it, the white coat hypertension?
Yes, sometimes the patient come, they have something like anxiety from the white coat or anxiety from the doctor. So their blood pressure is usually normal. But when they come to the room, when they come inside the clinic, they start to become anxious and their blood pressure shoot up. So
Okay,
that's why
so it
this-
just gives a false reading.
Yeah, yeah. So this is one reason why this approach has been changed. Now, we talked about the first approach. There is a second approach that there is you can diagnose a patient with hypertensive in only 1 day. Okay. How we can do that? We can give the patient a device called ambulatory
Yes.
blood pressure device.
Yeah.
Okay. We give the patient the device and tell him to resume his normal regular day. Okay. The device will take 14 measurements during the waking hours. Let's say from 8 a.m. until 10 p.m. in the evening. The patient comes in the next day. The device will calculate the average and will tell us if the patient is hypertensive or not. This is another way.
But
Yeah, but it's not really readily available, is it?
it is not. We should have it like
In some places we do
It
have it.
is
Like in our center we do have one, but
Oh, that's good.
that's very
but
good.
yani not all patients can use it because sometimes it's not available. We might diagnose or suspect that 2 patients or 3 patients in the same day that have hypertension, and we have only one device. So
So that
one of
was-
them only will yani,
What about the devices at home? So like there, you know, at the supermarket there is a lot of devices for measuring the blood pressure.
Yes, sure.
What kind of things you advocate for?
I'll show you a picture. This picture actually now showing is the device we use in the clinic. This is the most accurate device,
Yeah.
the manual device.
The mercury
Okay,
device.
the mercury device, exactly. Okay, the cuff has to be 2/3 the distance between the elbow to the shoulder. So we have to choose an appropriate cuff size for the patient to check his blood pressure.
Yes.
In the clinic, we have to check it when the arms is stretched, relaxed, and at the level of the heart. This is the correct way in the clinic. But at home, things are different. The patient might be not able to use the stethoscope or not trained to do so. So we tell them to use the electronic device. But not all electronic devices are recommended. Only the one used in the arm
Yes.
is the one that's recommended. The one in the rest is not recommended and not accurate.
Yeah.
So that's why we recommend them to buy an electronic device that's used on the upper arm.
Yeah.
Okay, and we advise the same way. Outstretch your hand, relax, and put it at the level of your heart. Okay, and check it. We advise him to repeat the reading twice, 1 minute apart between each reading.
And with time, the device actually should be checked with the doctor or should
Exactly.
be calibrated.
To be calibrated with the doctor.
To make
Yes,
sure
true.
it's giving the right or
Exactly.
the accurate readings.
Exactly. Yeah.
Okay.
And then, as we said, we take from 4 to 7 days, morning, evening, and tell the patient to come back. The patient can also use his device whenever he feels unwell. He can check his blood pressure, and if he feels that his blood pressure is high, he can always come to the doctor to get it checked.
Can you tell us what is the major causes of high blood pressure?
Sure. We have 2 causes of hypertension, or two main stems. The first one is primary or essential hypertension, which is the most common cause. About 85% of people have essential hypertension, which there is no cause identified. It may be related to lifestyle, maybe related to stress, maybe related to genetic susceptibility or inheritance, something like that, but there is no identifiable cause for it. The second main cause is we call it secondary hypertension. Now, secondary hypertension is related to many illnesses. Some of them like thyroid disorders. When you have hyperthyroidism, hyperactive thyroid, this might elevate the blood pressure. Other causes, tumors of the adrenal gland. We call it phacocytoma. This is another cause. It usually presents in the young people. Syndromes like Cushing syndrome might cause elevated blood pressure as well. And many other causes, like secondary causes. Narrowing of the renal artery, the main artery of the kidney, might also raise the blood pressure as well. So we have to check, and especially in patients, young patients,
Young
below
patients.
40 years of age. If a patient below 40 years of age comes to the clinic and they have high blood pressure, we have to investigate them for secondary causes of hypertension to rule out this 15% of the population that they have the secondary cause.
Now, what is your role as a family physician in detecting the cases of hypertension?
Yes, sure. As we are the primary healthcare, the first line defense, the first person that the patient meets when they become sick. So they usually come, like a patient might come telling the doctor, "Doctor, I have headache. Please check my blood pressure. I'm afraid of having a blood pressure because my father have blood pressure, my mother have blood pressure." So our role is to screen the patients that are more susceptible to blood pressure, because hypertension is a silent killer. It's a scary term, but it's the truth. It really kills people without knowing if it becomes undetected.
But of course, it's not directly.
It's not directly,
yeah.
of course, on the long term.
Yeah.
On the long term, if it becomes untreated, or if it has been missed and not diagnosed, or if it has became diagnosed and the patient did not comply with treatment, it could lead to many complications. So our role as a family physicians, as a first line of defense, is to detect first of all,
Yeah.
then to diagnose, and to treat the patient, and then to follow them up.
So, what are the complications of untreated hypertension?
Hypertension has many complications. It causes, as we mentioned in the beginning of the show, it is the main cause of cardiovascular disease, heart
Yeah.
disease. Okay, it can damage the heart. It can put some huge pressure on the heart if it becomes untreated. Also, it can cause stroke, hemorrhage in the brain, or blood clots in the brain. It can damage the kidneys as well. It can damage the small vessels in the eye. So it is very, very important to get the blood pressure checked for the normal person every 5 years, and for the person with hypertension, every visit. For renewal of medication, it is recommended that patient gets his blood pressure checked to check if they have if their blood pressure is okay with this dose of medicine, or if the dose need to be changed, increased or decreased.
Dr. Jabris, you mentioned that there's some people at high risk of having high blood pressure.
Yes.
Who are these people?
Obese people comes on the top of the list, plus people with diabetes. Also people with family history of hypertension. People who have a sedentary lifestyle. They don't move much. They don't exercise. Those people are more susceptible to become hypertensive. People who have high cholesterol level, high lipids in their blood, their serum of the blood. These are more susceptible to have hypertension.
What about pregnant women who develop high blood pressure during pregnancy
True.
itself?
True.
Will they be at high risk of having high blood pressure later on?
Sure.
Or do you advocate for a frequent follow-up of measurement of blood
If
pressure?
blood pressure presents before 20 weeks of gestation, before completing 20 weeks of pregnancy, this is called hypertension. It might be there before pregnancy, but it was not detected before. If it becomes detected after 20 weeks gestation, then this is pregnancy-induced. Pregnancy-induced hypertension have a big chance of developing to persistent hypertension. So it is very important for women after delivery to get their blood pressure checked. If they were put on medication during pregnancy, their medication might need to be changed 2 days after delivery, if the doctor decides to continue on those medications. Okay. If the blood pressure persists after 3 months of delivery, then this is called hypertension, and it might have been there as well before pregnancy, well before pregnancy, but it was not detected. So the patient might need to become on medication for hypertension lifelong.
Now, if you diagnose a patient with hypertension, I'm
Yes.
sure it can actually affect the patient very, very, badly. And some of them will take it as a serious thing, and it will change their lives very, very much. But what is your usually, what do you usually say first thing for a patient who has hypertension?
Of course, it's not easy for a patient to become diagnosed with a chronic illness, whether it was hypertension or any other chronic illness like diabetes or cholesterol, especially when they need to take medications lifelong. They have to comply with medication. Every day they have to take it. If they forget it for 1 day, it might not be good for their health.
Exactly.
Yeah.
So it's a huge thing, and
It's a huge thing. It's a
life-changing
major
thing.
change. They have to change the whole lifestyle. They have to change their food. They have to change their exercise habits. Okay, some of them, if they take medications like, let's say for example, if they take diuretics, for example, and they are at work, they might need to go to the toilet every now and then because of so it could affect, like it could majorly affect their life.
So what advice would you give a patient to change their life into something better?
Of course. For a hypertensive patient, we usually advise them, if they smoke, to stop smoking.
Yeah.
It is very important to stop smoking. Smoking and hypertension are a very dangerous
It's a
combination.
lethal combination.
Lethal combination. Very killing combination.
Yes, it is.
Yeah. So we advise them to quit smoking. Smoking is a vasoconstrictor. So it constricts the vessel. It puts more strain on the heart, more strain on the vessels, that it increases the blood pressure more. So it's we advise them to stop smoking. Second thing, if they have obesity, if they have weight gain, we advise them to lose weight. For every 10 kilograms of weight loss, the blood pressure drops by 10 regardless of medication.
Wow, that's
Yeah.
that's huge.
So
That's
for
very
example, if a
nice.
patient has a blood pressure of 140 over 90, and he's 80 kilograms, and he loses 10 kilograms, he
It's like
becomes
buy
70.
one get 10 free.
Yeah, buy one get 10 free, exactly. So this what happens. Blood pressure will drop regardless of medication. And many of them, I have many patients in my clinic that they lose weight and they don't need to become on medicine because their blood pressure is not that high, but they need just lifestyle changes. They lost weight, they lost 10, some of them 20, and they did not take any medicine. Now their blood pressure is very controlled, but under close supervision.
What kind of exercise you would like to advise your patient to have? I mean,
Moderate
how
intensity.
often do they have
Moderate
to do it?
intensity exercise, like walking and light weights. Maybe jogging as well. Okay, 30 minutes a week, 30 minutes a day, sorry, 5 times a week. That's 150 minutes a week. Okay, if the patient does not have time to do the 30 minutes at a time, he can make it like intervals, 10 minutes at work, 10 minutes in the afternoon, 10 minutes in the evening. The most important thing is to complete the 150 minutes per week in whatever way the patient can.
Yeah.
And if you think about it, it's only 30 minutes a day, 5 days a week. You have the weekends free. Do whatever you want on the weekend. 30 minutes a day. The day has
Yeah.
24 hours, so you have the rest of the 23.5 hours free. You can do anything you want.
I think
So-
with the exercise, there's a lot of additional benefits with regard to
Exactly.
lowering the blood pressure.
Exactly.
I think you will control your cholesterol status
True.
and also your glucose. I mean, you will prevent yourself from having diabetes later
True.
on.
Exactly.
And so it is a bonus if they have
Very true.
exercise.
Yeah, exactly.
What is your favorite type of exercise?
Running.
Running, huh?
I like running, yeah.
So I think running is a really good option because
Exactly.
there are places to walk everywhere now, and the weather is amazing. So there
Exactly.
are no more excuses
In each
for
single
people.
area. In each single area we have
Yeah.
some place to walk and to run and to do some exercise. Even if
I
you are
think,
not able to join the gym, you can
Exactly, but sometimes people do have certain reasons why they couldn't run. For example, joint pain or knee pain or certain injuries. So what do you advise these people to do?
physiotherapy that can help them, and also swimming can do it. If they have joint pain, they cannot weight bear. Swimming is a very powerful weapon we can use for patients
Yeah.
with joint problems,
So why do you think it's really good for them specifically?
because it will train their heart.
Mhm.
It will make them more fit. It will reduce the strain and pressure on the heart. It will make their heart pumping function of the heart better. So in that way, their blood pressure will become lower.
Yeah, exercise is extremely important. That, as you mentioned, it's really good for the heart.
Exactly.
And also, it's actually good for the skin. So, I mean, if you really want to stay younger, you should totally go exercise.
Exactly. Not only for the skin, not only for the body. Also, mentally, exercise is a treatment for
Yeah.
depression,
Even for depression,
anxiety, for many sort of things. You just name it.
Yeah. And you mentioned like exercise has a lot of benefit for the blood pressure control. What about diet? Is there any certain advices you would like to give the hypertensive patients with regard to the diet?
We usually advise hypertensive patient to take a low salt diet. Okay, because salt increases, sodium increases.
Yeah.
Sometimes we tell them also to take sodium substitutes if they want to have the taste of the salt in their food. We tell them to take salt substitutes. It's available in the supermarkets, it's available in the pharmacies. Okay, Another thing is to reduce the coffee intake. Okay, increase the vegetables and fruits. Eat more fruits, more vegetables. An apple a day keeps the doctor away.
Yeah,
Okay?
I think
This has been
I
said
totally
many
believe in
times,
that.
long times also.
But what about tomatoes? Like people with hypertension, they have a thought in Kuwait that tomatoes will reduce their blood pressure.
And the
Have you-
garlic, they have a lot of obsession about garlic.
Garlic,
well,
they say
yeah.
also garlic reduces cholesterol, but there is no enough evidence to support this.
Yeah.
It might reduce the total number, the total cholesterol. It might reduce hypertension a little bit, but it has no effect on the long-term morbidity or mortality. There is no enough sufficient evidence about it.
Exactly.
That is a very nice overviews about the lifestyle modifications for patients with the high blood pressure. As you see, Dr. Jabir, there is a lot of options with regard to the drugs or the medical treatment for the patients.
Yeah.
On what basis do you have to choose which drug will be suitable for one patient and which drug is not suitable for the other patient?
It depends on few factors. The main two factors are age and ethnicity, and also depends on the patient, the comorbidities the patient have, other illnesses the patient have. We usually divide the patient above 55 years old and below 55. With the above 55 category, we put the Afro-Caribbean origin people. Okay, studies have shown that people below 55 are responds better to certain types of drugs called either ACE inhibitors, angiotensin converting enzyme inhibitors, or the ARBs, angiotensin receptor blockers. These two kind of drugs do well with patients below 55. For patients above 55 years old or patients of Afro-Caribbean origin, we usually give them a class of drug called calcium channel blockers, or CCBs. Another something we have to put into consideration is diabetic patients. Diabetic patients, regardless of their age, if they have blood pressure, like let's say we found a high blood pressure, they have high blood pressure above 140/80. The target is different for diabetic patients. So if we find that they have blood pressure above 140/80, we might put them on ACE inhibitor, same as the patient below 55 years old. Okay, because it was shown by studies that it protects the kidneys against kidney damage. So we put them on this type of drug. We give the patients above 80 years old the same treatment as the patients above 55 years old, so the same. But the target level for their blood pressure is little different, little higher.
You'll aim for a little bit more.
A little bit more higher target, like 150/90.
Okay.
Now, when you decide to start medicine to a patient, of course, it's, as we said before, it's actually a huge change and it will actually affect their daily lives. So what are the issues do you face when you prescribe medicine to a patient?
Yeah, resistance from the patients. Sometimes they refuse because it is a life change. They have to take it every day. And some patients are hesitant to comply with a medication every day. Another thing is side effects. Side effects, the patients are worried about side effects. They hear about stories from their friends or relatives or families that they suffered from a certain side effect from a certain drug.
Yeah.
Yeah. So these are the two main issues. Side effects and compliance with medication. Resistance. Some patients want to try lifestyle changes first. They are keen to do some exercise and weight loss. And this is totally right. There is no objection on a patient that wants to try lifestyle if their blood pressure is not severely high. We can tell them to go do exercise, do lifestyle change their diet for 3 to 6 months, and then ask them to come back. If they manage, if they are successful in reducing their blood pressure with lifestyle change, we might only observe them. But if they fail to reduce their blood pressure with lifestyle change, then we have to convince them to start treatment to protect their heart, to protect their brain, their eyes, their kidneys against the complications of hypertension.
Is there any certain investigation you would like to offer your patient initially during the first diagnosis and probably later on while
Of
he's
course.
on
We have to check the patient's cholesterol, total cholesterol. We have to check their blood sugar as well, because they are comorbid risk factors also. They are cardiovascular risk factors. The combination is, as we said, lethal if you have those untreated. You also want to check the renal function of the patient. You want to check their electrolytes, their liver function. And you also want to check a tracing of the heart and a chest x-ray. to check if the heart is enlarged because of blood pressure, of the persistently high blood pressure or not, or if the heart is affected or the oxygen is not reaching the heart enough. You can detect that by doing a tracing of the heart by a device called ECG, electrocardiogram. Those are the main things we want to check for a blood pressure patient.
And is there any eye investigation you have to do also?
Of
for
course,
that?
you have to send the patient to do fundoscopy to check the eyes, the small vessels in the eyes, in the back of the eyes, to check if they have any damage done by the hypertension, especially if they have been missed for a long time and you don't know about them. We want to know the baseline of their eye check,
Okay.
to compare yearly, annually, or one year or
Once a
every 2
year.
years we
Okay,
check. Yeah,
good.
we have to check it as well.
I think it's a major issue as well, is to remind the patients, because the problem we face usually here in the polyclinics is that we usually don't follow up the same patient.
True.
And this is a huge issue, and we don't have usually, as you know, we do have diabetic clinics in
True.
most clinics, but I mean hypertension clinics, I think we rarely find them now in the polyclinics as
Yes.
well.
Yes.
So what is your major concern if you don't see patients that were the same patients all the time, or if they keep on changing on you? What do you think?
Usually we try to tell the patient to come to the same doctor, try their best, because our work is different. Sometimes we work in the morning, sometimes in the afternoon, that the patient has no idea about our schedule. We tell them to do their best, and we do our best to find some time that suits us both. Okay, so that we can follow them up with the same doctor every time.
Yeah. I think nowadays we're trying to create special clinics for chronic disease, especially hypertension
Exactly.
and also high hyperlipidemia, which is high cholesterol.
True.
And these clinics should be dedicated for these hypertensive. And this is
Absolutely,
a new things
absolutely.
going on. We'll have good care for
Exactly.
these people.
But still, some centers, they don't have this facility still until now. Some centers are able to do the hypertensive clinic. They have enough staff to facilitate this type of clinic. And some centers, no. The center might be busy, or there is no enough staff. So,
Because it should be as important as diabetes.
Exactly.
There's a lot of clinics for diabetes.
Exactly.
And there should
True.
be
Exactly,
as well.
and because these are the diseases that can lead to major problems like
Later on
cardiovascular
in life,
diseases
yeah.
and also damage to the
True.
organs as well.
True.
So the thing is, as you mentioned before, something about smoking, that patients with hypertension or without anything should stop smoking. So can you just comment on that?
Yeah, sure. As I mentioned before, smoking is a major risk factor, not only for hypertension, for cholesterol, for diabetes, for cancer, for lung disease, COPD, the chronic obstructive airway disease, for asthmatic patients. So it puts a huge impact on the healthcare, smoking. You can't believe it how much smoking puts pressure on the healthcare without the patient knowing and without the doctor even feeling. So it is very important to quit smoking. If you are not damaging your health, you're damaging others' health,
Exactly, yeah.
other people's health. Passive smoking is worse than active smoking.
And I mean, passive smoking here is everywhere in the malls, and sometimes even certain centers. So you find them everywhere. So it's very dangerous, and there should be
more
regulations.
regulation with regard to stop smoking.
I'll tell you some story that happens in the clinic. A father came with his child.
Yeah.
Okay, the father is a heavy smoker. You can smell him smoking from outside the clinics, the smoke in his clothes.
That's
the smell.
terrible.
He came with his child. His child is asthmatic, and his chest is wheezy and very severe asthma. And the father is blaming his asthma on the weather change. He said, I don't know, every time the weather changes, the child is asthmatic, becomes asthmatic.
He's a major trigger.
Yeah, and he's ignoring that his smoking is a major risk factor for his child's asthma.
He
So
wants to
this-
control the weather, but not to control himself.
Exactly,
without smoking.
exactly.
Yeah.
And I don't think he thinks that smoking is dangerous. It's also about the education of the patient.
True.
I think he's also in denial, and he's like, smoking. It's like seat belts here.
True.
Like, people are in denial that seat belts are important in driving.
True.
So I think it's the same thing as well with smoking.
Until a catastrophe happens.
Until a
Exactly, yeah.
catastrophe happens.
Yeah.
So, Dr. Jabir, can you tell us, is there any way that we can prevent ourselves from having or developing hypertension? especially if we are at high risk of having diabetes because, hypertension,
Hypertension, yes.
because of the, sedentary lifestyle that we are living. Is there any certain advice you would like to give us?
You answered the questions in the question itself. Lifestyle changes. Exercise. A sedentary lifestyle will make you definitely will have hypertension. Okay, so exercise, move. يعني, even only 30 minutes, it's only 30 minutes that's required a day.
Yeah.
It's nothing. You don't need to go to the gym to do the 30 minutes. The way to the gym is 30 minutes, so just use it, walk outside. The weather, especially now, the weather is very nice. It's becoming very good. You can walk outside. Even when the weather is hot, you can walk in the evening, for example.
Of course,
No problem,
yeah.
So quit smoking, as we said. Increase your fruits and vegetables in the food. Reduce the amount of red meat. We call it the Mediterranean diet. Mediterranean diet, lower meat, higher fruits and vegetables.
And we're not talking about pizza or
No.
pastas.
No.
That's not
No.
the only Mediterranean food.
Mediterranean
I think it's more than that. So.
Yeah. Also, try to cut down the amount of coffee. Coffee raises the blood pressure, raises the heart rate.
Yeah.
So this is another thing. Salt. We advise people with hypertension to take a low salt diet, but you can't advise people without hypertension to do that. There's no
There's
reason
no
why
need.
you tell someone don't eat salt when they don't have blood
Eat
pressure.
in moderation.
Eat in moderation.
Everything in moderation.
Everything
is
in
good.
moderation, exactly.
With a little bit of exercise.
With a little bit of exercise and quitting smoking.
I mean,
and
a lot of
reducing
exercise, maybe.
30 minutes only.
Okay, thank you so much, doctor, for being here. It was a real pleasure talking to you, and oh my God, it's really good advice you gave to
Thank you very much. I
everyone
appreciate it.
watching the show. So thank you so much.
Thank you so much.
Thanks, Dr. Jabir, for
Thank
this
you.
lovely, educational talks for a lot of people that we have with high blood pressure. I hope lots of people now who are hearing us will get actually the benefits from your talks and
I
your
hope so.
advices,
I hope so.
especially emphasizing on the exercise and the healthy life diet.
Exactly.
So thanks a lot for accepting our
My pleasure.
meetings
My pleasure.
for today's, and hopefully we're gonna see you later on.
Sure, of course.
Hopefully, yeah. And of course, thanks to all our viewers for watching us tonight, and I hope everybody gets the message. And just, living a healthy lifestyle just gives you a healthy life as well. So have a good night, everyone.